go to a meeting that we have only allows 25. So some of you we asked to join on the second tour group, and we know some for one reason or another intended to be on the first group and make it. So you have probably read a little bit about who we are. Michelle has called and said she won't be able to make the tour, so Lori and I are going to be handling that. So we're going to be going on with the instructions, and for this I'm going to unmute everyone who is here. What I'm going to ask you to do is to make sure that your volume is rather low, because we noticed when using this software, if you have your volume high, we get an echo. So you may notice that I'm now unmuting everybody gradually. So again, turn your volume down pretty low so we don't have an echo. Here's the instructions for this tour. It's going to be taking you on the different sites of our organization. You're going to learn about some recent things that we've done, some things we plan to do in the future, and how you can participate. If you have any technical problems during the meeting, you need to call this number. You see there, 1-888-259-3826, or call the number that you received in the email notification with the link that you got from Lori. This meeting is going to be recorded, which means I need to go ahead and push start recording. So, as I said, the meeting is being recorded. We're going to be flipping back and forth between the screen here that has instructions and a map, and then the website. Pretty soon you're going to be put on mute, and all but Lori and I, your tour guides, will not be able to be heard by the others. But there is a chat box, and unlike the tour guide that was in Pee-wee's Great Adventure that you see a picture of here, which, by the way, her name was Tina also, we're not going to require you to hold all your questions till the end. You can ask questions all along the way, but since you'll be on mute, we will ask you to type in your questions in the little chat box of your GoToMeeting control. You can look towards the bottom. If there's a plus by it, push on the plus and it'll drop down the little box, and just type in your little questions as we go along. After we visit each site, we'll entertain your questions. So type them in as you think of them. When you hear of an area where you want to help join our efforts, we ask that you will type that into the chat area that you see. Again, it's on the bottom right-hand side. After the tour, we're going to stop the recording, and then you will be unmuted so that we can have a conversation with those who said that they want to help us in our future projects. We're going to move quickly. We're hoping it's going to last about an hour. There's not going to be any breaks, so if you can go to the bathroom whenever you want, and you'll just need to catch up with us when you return. So I need to know from everybody, are we all ready to go? Hello?
Yeah, some people have put themselves on mute, and I'm seeing yeses.
Okay, so those that are still unmuted, are you ready to go?
Yes, ma'am.
Yes, yes, yes.
Okay. Okay, good. So Lori's now going to put everybody on mute.
Okay, Tina, you're unmuted too, and I think everybody can hear me also.
Yes, that's good. Yeah, when I said everybody on mute, I didn't mean me.
Well, when I press mute all, everybody, including you and I, go mute.
Okay, great. Well, let's start with the tour. We're going to begin with the history and the mission of rebranding and why we group these illnesses together as needs, and how we get our funding. So here is and what we're going to talk about is the history. So let's take a look at that right here. Pandora.org started originally as a support group in Michigan. Then in 2000, it kind of fizzled a little bit, and then in 2009, Lori Chapo Kroger in Michigan, re-energized it and renamed, and it was the CFS Solutions of West Michigan. Now, somewhat simultaneously, or during that time, there was an organization started in Florida, and that was the Patient Alliance for Neuroendocrine Immune Disorders Organization for Research and Advocacy Incorporated. It was Marley Silverman who started it, and she that turns into an acronym of PANDORA. And her activities was local, but it very quickly became national advocacy. So that organization started working to try to change policies in the federal government for these groups of diseases. Now, last year, Molly Silverman retired, and out of those two organizations, we had a new 501c3 that was formed, and it's now called the Pandora Org. Lori Chapo-Kroger is the president of it, and with that, we had some rebranding that we've been working on for the last 9 months. We have this new website, we have this logo that you see here, and we need to complete our rebranding with some work that needs to be done on our social media. Now we're going to talk about the mission. So if we go to our mission and vision, you see that the number one thing that we are concerned about is improving the patient quality of life for people with these diseases. And we're going to be talking about how we do it through collaboration, and we do it through advocacy, and we empower patients. And these things right here are going to be things you learn about today, some special areas of activity that we do. Now, many people have asked us, well, why don't you just advocate for my disease? Most organizations focus on one disease. And we cover this in this section of our website. We have found that each of these illnesses are underserved. They get very little funding from the government. They are all very difficult to diagnose. There's no widely accepted biomarker. They need changes in government policy. They have similar or the same symptoms. They also all need to have more physician education. So as some organizations have tried to advocate or educate for these diseases individually, they find that because a lot of the people who are trying to do that are themselves very sick. And so, and these diseases, once you get one of these diseases, it depletes resources. So by working together, putting these illnesses together, we find we've been able to advance the cause better, and because they often occur simultaneously in people, that we need physician education to be on these groups of diseases. They are all chronic multi-system illnesses. Also, politicians are generally not very concerned with one illness, but once we start to talk to a politician, we may find that maybe he doesn't have that much of a concern about Lyme disease, but his mother had fibromyalgia. So then we can connect with them on a personal level and get their interest by having these groups of diseases. And we have found some success by doing that. Now we need to go to funding. Pandora Org generally operates by having a project that we see we want to do. Then we go and we find a funding source, whether a grant or we do a fundraiser, and then if we get enough money through that, we can accomplish that project. Right now, we have this contest going on where we have an opportunity to win $2,500, and if you will vote for Pandora on this website here, you may have to join their website, and you see you can vote, which I've already voted, but you would vote there. And the voting ends on July 24th. We also encourage you to vote for Phoenix Rising, which is also another organization that advocates for two of the diseases that we represent. We also receive grants, as I said. You can see the grants we receive. They're commonly from these fundraisers like we're doing now. They're from online contests like we're doing now. They're also from drug companies. And this is a need that we have for help in getting more help with fundraising. But I think Lori is going to be talking about that more. We would like to broaden it to look at other businesses that can do grants. We're looking at a business partnership that can do fundraisers for us because we're sick and so we're limited in what we can do. And we're also, as I said, on the rebranding, we have a need alert there where we're looking for somebody who can help us to complete our rebranding and the work we have to do on the social media. So, Lori,
Yes.
did anyone have any questions in that segment?
I did not see any typed in the message or in the chat box. So if you do have any questions on that segment, you can still type them. Well, Tina, I think, goes back to our tour map for a few minutes.
I will, but you know, I forgot one.
Oh,
Let me
okay.
go to this for fundraising, and that is eBay. We've been doing this a long time, but we really haven't been promoting it. And we'd like to make sure we mention it, which I had forgotten, and that is if you are going to sell an item on eBay, if you are going to be purchasing an item on eBay, you can arrange it so that we get 10% or up to 100% of the price of that item, whether it's giving or purchasing. So just wanted to mention that. And then, yes, I will bring back the map. And our next stop is going to be organizational structure, and Lori is going to be happening that. Does everybody see that on the map? Yep. Next stop is organizational structure. And Lori?
Okay. And I want to say, hold on to your, buckle your seatbelts, everybody, because here we go. Our organizational structure, we have board members and everybody who was involved with our organization. They all must agree to apply to policies and code of ethics, and they will be interviewed and trained for each of the positions. And here you see our board of directors. And what they do is we decide by vote, and they talk about the business aspect of the organization, and then we decide by vote. And we do have a need alert here too. For a board member, you could see that we would need a few more, and we do meet at least quarterly. And then, of course, when spring and fall time come around, and there are the CFSAC, the Chronic Fatigue Syndrome Advisory Committee meetings, and some other things, and FDA come around, we seem to be busy there, then we might meet a little bit more than just quarterly. But we do have a needs alert there. And we do have 3 board committees, and they are the bylaw and policies, where we review and revise policies. And then we have an interview committee. And then we also have the fundraising committee. And like Tina mentioned before, we do need some more people to be involved in the fundraising. An organization cannot be ran without funds. You can't have programs, and you can't have projects, or even help some of the patient community where you will see in our patient assistant program. But to be on the fundraising committee, you must be a board member, an officer, ambassador, or chapter facilitator. And what we're doing is we're looking for people who can maybe write grants or help us with fundraising projects, and maybe even connect us with a business partner. Okay, then we're going to go over to the officers page. And officers, they carry out the decisions of the board, and they do the day-to-day operations. And Toby Vocal is our secretary right now, but he will be rotating off. And so we do have a need for a secretary. And what that would involve is taking notes during a board meeting, doing some summaries for us, maybe on special occasions, create a Excel database for us. And so those would be some of the needs of the secretary. And if you are interested in any of these positions as we're talking, you might want to type them in that chat box on the side control panel. Okay. Then we'll go to the advisors. Now, our advisors, they do just that. They advise us on certain aspects of either the business or even disease specific. And we do have a needs alert. As you can see under legal counsel, we do have a need for an attorney that can advise us on nonprofit and some legal issues. So if you know of anyone or you yourself are an attorney and would be able to help, that would be great. And as you could also see, Dr. Andy Kogelnick, he's our medical advisor, and Sandy Lanford, she advises us a lot on Lyme disease, and she has her own organization called Lifeline. Now, as we go to ambassadors, my screen fell asleep, sorry there. As we go to ambassadors, they work in Pandora org education, advocacy, or awareness efforts, and wherever their interest lies. Training is provided for our ambassadors, and we do need more ambassadors, particularly some who live in or can afford to travel to Washington, D.C., so they can attend some of these advisory committee meetings. New that we're going to be having in our organization are chapter facilitators. And chapter facilitators lead a local group that works in Pandora org education, advocacy, or NEI center. And the NEI stands for Neuroendocrine Immune, the multi-system. And then they also work in awareness efforts. They might facilitate a patient support group or wherever their interest lies. And again, chapter facilitators are invited to be board members after a probation period. Now, Tina, were there any questions during that segment?
No.
Okay.
No. If you have any questions on this section that Lori talked about, you can go ahead and type them, even though we move on to another side. We don't have to take them in order. But so far, Lori, we haven't had any questions on that.
Okay.
So I guess we need to look on our map to see where our next stop is. Physician and nurse education. This is one of my favorites. So let me bring that back. So under the CME course that was just done here recently in May included 45 physicians and 24 others. And you can see a picture of it there. It was done in Alabama. And we got a hospital to sponsor it, and it was on MECFS. But they have also agreed to do a series of them. Tick-borne infections is going to be included, as well as fibromyalgia. And we've already submitted names of other physicians that can do that for them, and they've got a committee that's reviewing those. In the future, we want to do more CME courses and also to distribute the IECFS-ME primer through physician groups. It doesn't have to be hospitals. There's even companies that do CME courses. So if you are interested in doing that or trying to get more information to doctors about this, then let us know. We'll help you, and you'll need to do a little work to find the opportunities in your area where we can spread the news and educate the doctors and nurses about these diseases. So that is a need alert we have. Now, we had a question, and I think this one probably is going to be for Lori. It says, are ambassadors only in the U.S.? Lori?
To be honest with you, I don't know about that yet. I think I would have to bring that up with the board member. I think that ambassadors, I know that we're nationwide, but I don't know about worldwide. I would have to look into the legalities of that, I believe.
Right. If there's anything, if we were to have an ambassador in another country, would we have to be registered in that country?
Right.
Would we have to, you know, other things like that?
Yes, it's
So
not that we don't want
we
to.
will. Okay. And the comment is that at one time, when Marley was running that organization, that she referred to someone in another country as an ambassador. So it may be that it is no problem, but that's something we would need to find, you know, look into, and we'll find out. We'll certainly let you know.
And certainly you can be an advocate extraordinaire in another country. We do have the advocate extraordinaire program.
Which brings me to my next topic, or the next site on our tour, and that is patient assistance. And so let's get to that. Well, actually, let's start off with education with patients. We do provide patient education. One of the programs we have is the Advocates Extraordinaire. That is where we, often through webinars, but sometimes in person, we will provide training, particularly to how to be effective advocates to the government, but also how to speak to the news media. As part of patient education, we also have a newsletter. There's a Michigan support group. And of course, we have said we're open to having other support groups that are basically chapters. And then we can share that same information that we get, that we provide in our Michigan support group with those in other areas. We also have the social media, and that is one of the areas where we need an ambassador to help in helping with the strategy, social media strategy, but also the ones that we have that are doing the social media now, they, you know, we're sick, and sometimes we can't be as consistent in our work as we would like. We need to expand more in our YouTube. We need to expand more in our Twitter. We're doing Facebook pretty good, but we need to start using these other platforms. So if you have an interest in that, we could do a little training for you, show you what's appropriate, what's not appropriate, and then we'd love to have you join us in providing that patient assistance education through social media. If you are also interested in being a chapter facilitator and having a support group in your area that where we help with some of the resources, the material, we provide training, we provide the brochures that you use, then let us know. That would be a chapter facilitator position. Also, let's go to the direct patient assistance we have. If you are a patient of one of these diseases, you probably have many medications or medications that you use. It can be quite expensive. We've partnered with Needy Meds to help patients with low-cost medications. So we encourage you to go to this page on our website to look at this little presentation, and that nonprofit, Needy Meds, can help you with low cost. Where you would find it is under patient resources right here, then low cost medication. We also have, some people have donated goods, and we have then distributed those to people, and that would be under this direct assistance. We have won grass cards, and we've given out these to patient advocates, but also patients who are in financial need. We're actually been doing that currently through our Facebook page with drawings for the Citgo gas cards. They're $100 each. So if you're a member of our Facebook page, then we hope you've participated in those drawings. And we just had one that we gave away within the last 2 weeks to a patient. We also have helped in the past patients through donated electronics, because these diseases are very isolating, and sometimes the internet is the only way they can connect to others. So we've had people that have donated their older technology. Then we give it out to other patients. We'd like to expand this part of our program so that we're also maybe working with companies that may donate grocery gift cards, or actually donate meals, or donate money that we can then directly give to the patients. we're also looking at possibly linen. So if you are interested in helping with that part of our organization's activity, again, let us know, and we will see if we can get you to join with the people that are doing that, because that's something we want to expand. So Lori, I think that finishes the part about patient assistance. Was there any question? Were there any questions?
There weren't any questions. There were a lot of comments, but some of those can be addressed when we unmute everyone and have a discussion. There were just some, I'll just bring up a couple of them, is that, let's see, we can coordinate a lot together, whether it's official or not. And I said that we certainly believe collaboration is important with everyone because that makes our voice stronger. And Shauna would like to be part of a support group in the area if there's not one. And then CB said we can possibly have CME courses on McGill CME site. So those things we can talk about towards the end.
Great. Okay, let's bring up the map and see what our next stop is.
Okay.
Looks like it's advocacy, and Laura, that's your area.
Yes. As you know, for a long time, Pandora org has been very strong in the advocacy realm. And recently, we were in Alabama, and we had the legislator approved and signed a resolution of needed medical professional education and creation of a center. And here you'll see that the governor is signing with the group that went to the Capitol to have him sign that resolution. And that's one area we would like to have, we have a need alert. We need more state and government resolutions. We now have one in New Jersey and we have one in Alabama. And I have been working here at my state and local government to have one done, presented in Michigan. And so that is one area that we have a needs alert. Then we also go to CFSAC. You've heard me mention that quite frequently throughout this talk, and it stands for Chronic Fatigue Syndrome Advisory Committee, where that committee makes recommendations to the United States Secretary of Health. And we have ambassadors, or we attend twice a year to go to that. And right now, currently, what we are doing is also urging patients to send email to the FDA for another meeting on MECFS. And with others, we got the FDA to have a workshop on MECFS, and we had an ambassador there. We advocated the FDA for continued access to pain medication. In the future, we are about to send a letter to the CDC for changing the name of MECFS. And this is a follow-up to our letter back in January of 2011. And we also have been working for 2 years to have chronic fatigue syndrome reclassified into the neurological chapter of the U.S. Diagnostic Code Manual. We heard back that they are going to be leaving it in signs and symptoms. But we would also like to have fibromyalgia be reclassified in the ICD-10 also. We have been invited to Partners Against Lyme and Tick-Associated Diseases. They call themselves PALTAD. And it's a meeting in October, and it's about Lyme. It's a Lyme advocacy organizations to start collaborating. And we really want to go, but we don't have the funds at this time. And we really would like to get more involved in the Lyme advocacy and Gulf War advocacy. And this is where we have a needs alert for a Gulf War illness ambassador and also a Lyme ambassador that would be able to go to some of these meetings and represent Pandora.org. And again, that would consist of being interviewed, going over the code of ethics, and being on a probation period. So if anybody is interested in that, please type that in. And I think that goes back to our tour map.
That's right, and I don't see anybody asking any questions on that. Again, if you think of some, just go ahead and type them in. And we've only got, looks like, how many stops? 2 more stops left. And then after that, we're going to unmute everybody and we'll have a discussion if you see that there is a need. Well, we have a question. It says, where are the meetings? So, Shauna, we'll talk to you afterwards. A lot of these a lot of these federal advisory committees are in Washington, D.C. The PALTAD, we were told, is going to be up there in that area, isn't it, Lori? Somewhere around Washington, D.C.,
yes, it's
right?
going to be near Washington, D.C., yes.
So because you'll notice that one of the need alerts we had was hoping for an ambassador that lives in that area, simply because it costs funds for us to send somebody. Now, we'd love to send somebody, but that would mean that we would need to arrange for the travel, covering the travel expense and things like that. So the advocacy meetings tend to be in Washington, D.C., and just so happens PALTAD is having their organizational meeting with other advocacy organizations in Washington, D.C. So whether we can send somebody there on our behalf, if we don't have somebody who already lives in the area that can represent our organization, then that will depend on the funding. So I guess the next thing is awareness, right? Awareness.
Yes,
there we
awareness.
Go. Awareness, that's me, and there's that little ad I designed. Okay. So, awareness. You will notice that we found what we thought was a good opportunity. We placed this ad, and it's running now in Traverse City, Michigan. It is in this, I guess it's a magazine that is sitting in doctor's offices. And so when you have somebody who's going to the doctor and they may not be feeling well, you can see we're advertising to them about the 3 of the 4 cardinal symptoms of these illnesses. And then we're thinking maybe they may look at it and go in and say, hey, doc, I have these symptoms. Might I have one of these diseases? So that's a good awareness. It also may help get doctors become more aware of these illnesses and the similarities between these illnesses. If you know of a magazine like this that is in your area, we found this was a good price. It lasts for 6 months. It was also an insert in the newspaper, so we felt that was a good use of the funds, and we'd like to do more of it. So if you have an interest in creating more awareness for these diseases, then we would like for you to let us know. We have a need alert for someone to help find those opportunities and help us to get contact and figure out the cost and get that going. We also, for awareness, we were successful with a couple of local government bodies, cities that declared May 12th or the month of May as Awareness Month for these diseases. We also, for awareness, have been speaking to civic clubs such as the Rotary Club, and we also maybe civic clubs. In Alabama, we've already spoken to 3 Rotary clubs, and one of the reasons that this is good is because one of the diseases that we represent also used to be called atypical polio, and the Rotary Club International is really big on eradicating polio. So it's a good jump-off point to help them become familiar with these diseases. Commonly, these civic clubs will meet weekly, so they're often looking for speakers. We will provide training. If you would like to try to do that in your area, we've already got the presentation prepared. We will train you and then help you to know how to arrange that with your local clubs in your area. Also, we have some public service announcements with, we've got a great one that's about Lyme. It's a little old, but it's still, of course, current. And then we also, through our Emmy CFS Worldwide Patient Alliance, we did a public service announcement through there on MECFS, and we have a need alert as an ambassador. We'd like to get more exposure to these PSAs. They're well done. I encourage you to go look at them at our website later, and we just need to get them aired more, but that's going to take a little effort to connect with the news media and figure out how to get that done. We have had them, all of them have been aired on the TV, at least some. We've just been approved for a grant for some brochures, so we want to start having booths at health fairs where we can distribute these brochures, and that brings up another need alert. We need somebody who's going to go to the health fairs in their local area, maybe pass out those brochures and talk to the people. Again, we provide training and we'll provide the brochures. So was there any questions on this, Lori?
There were no questions that I saw, but we do have that there is that Unicorn Children's Foundation that's mostly autism, but all learning and other mainly in Florida, also office in Montreal. And I'm not sure if that is pertaining to the magazines or the printed advertisements.
Well, we have one more stop, and so after that stop, maybe we can talk about those things. Okay, last stop is NEI Center.
Yes.
And so
the NEI,
we hope you haven't been too tired out from our tour. We've got one more stop, and Lori's going to talk about that.
Yes. And the NEI Center, the Neuroendocrine Immune Center, is something that has been really a part of my dream since the very first when I became ill, because it was very difficult for me, even being a healthcare provider, to navigate through the system. And I was just totally amazed, but not in a wonderful way, of how long it took to become diagnosed and to get proper care, and how sometimes it still is hard to get the proper care. And so starting an NEI center where knowledgeable medical professionals can be in a clinic where it's easy for somebody to become diagnosed and to get the care. And we're making progress in this area, creating a center in Alabama. And we did talk with senators in Alabama, and we also in Florida. There was the International University. They said that they were interested in establishing a center. And then also in the New Jersey work in 2010 with Pandora and Lifeline, where we successfully had the resolution. But the soil seems to be very fertile in Alabama right now. And what it just took is to talk to the legislators, to talk to the CEO or administration of hospitals. And this is another need alert we have, where we would like ambassadors or chapter facilitators to work toward creating a center in your area. And again, that will involve going to Chamber of Commerce meetings, at networking with politicians and business leaders, and speaking to doctors and healthcare administrators. And so because this is just a multi-system disease, and there is not a specialty for this. If you have a heart condition, or you go to see a cardiologist. If you are diabetic, you go see an endocrinologist. But when you have one of these illnesses, there is no specialty to go to. And so this is one of our dreams here, and we're hoping that it happens very soon. And
okay, great. Well, that stops our our tour, one last thing I need to point out to people is that whether you're here now or you're listening at this recording later, if you decide that you would like to help, you can go to our website. It's pandoraorg.net, and right up here you can click on that little form and then just fill it out and tell us what is your area of interest. We'll get back in touch with you and see what would be a good fit. We're going to thank everyone who's listening by recording, but those of you that are currently on the tour with us, we're going to ask you to stay if you'd like to be part of the discussion on how we can work together. And so I'm going to stop the recording now.